If you've ever been told your prostate is enlarged, here's a shocking truth most men never hear. Size alone doesn't decide whether it's a problem. Symptoms do. I've seen men with large prostates feel perfectly fine, and men with smaller ones struggle daily. So before you panic, stay with me, because what you're about to learn could change how you see your health forever. Now, let me ask you something important. Have you noticed changes in your urination, sleep, or comfort lately that made you wonder, is my prostate too big? Share your experience in the comments below, because you're not alone, and your story could help another man feel less isolated. I want you to hear this clearly from the start. The prostate naturally grows as you age, and that growth is often normal. By the time many men reach their 50s or 60s, the prostate may be larger than it was at 30, and that alone doesn't mean danger. What matters is how that growth affects your quality of life. I've spoken with countless men who felt scared just hearing the word enlarged. They imagined surgery, lifelong medication, or worst-case scenarios. But fear thrives in silence, and clarity is what restores peace. Part 1 begins with understanding what too big actually means in real life. Medically speaking, the prostate is often measured in grams or volume, but numbers don't tell the full story. A prostate around 20 to 30 grams is typical in younger men, and many older men live comfortably with sizes well above that. Here's the key point I want you to remember. There is no single number where the prostate suddenly becomes too big. I've seen men with prostates over 60 grams who had no symptoms at all, and I've seen others with much smaller prostates who struggled every day. The prostate sits just below the bladder and surrounds the urethra, the tube that carries urine out. When it grows in a way that presses inward, it can slow or block urine flow. But growth doesn't always happen in that direction, and that's why size alone can be misleading. So instead of asking, "How big is my prostate?" I encourage you to ask a better question. How is my prostate affecting my life? Are you waking up multiple times at night to urinate? Do you feel urgency, weak flow, or incomplete emptying? Those signs matter more than the measurement. Let me pause you here for a moment. Have you ever dismissed these symptoms as just aging? Many men do, and that's understandable. But accepting discomfort as normal can quietly drain your energy, sleep, and confidence. Part 2 is where we talk honestly about when prostate size becomes a concern. It's usually when symptoms begin interfering with daily life or causing complications. Frequent nighttime urination, repeated urinary infections, bladder stones, or difficulty emptying the bladder are signals to pay attention. I want to reassure you. Noticing symptoms does not mean something terrible is happening. In most cases, these changes are related to benign prostatic hyperplasia, or BPH, which is not cancer. That distinction alone brings relief to many men when they finally hear it explained clearly. One of the most common complaints I hear is poor sleep. Waking up 2, 3, or 4 times a night to urinate slowly wears you down. Sleep deprivation affects mood, memory, heart health, and even relationships, and it often starts with the prostate. Here's a practical insight you can use today. Track your symptoms, not just your test results. Pay attention to frequency, urgency, flow strength, and how often you wake at night. This information is incredibly valuable when you talk to a healthcare professional. Some men worry that if their prostate keeps growing, surgery is inevitable. That's simply not true. Many cases are managed with lifestyle adjustments, monitoring, or medication when appropriate. Modern prostate care is far more personalized than it used to be. Let me share something I've learned over years of listening to patients. The men who do best are the ones who stay engaged with their health instead of avoiding the topic. Awareness gives you options, and options give you control. Have you ever noticed how stress can worsen urinary symptoms? That's not in your head. Tension affects muscle control and bladder sensitivity, which can make symptoms feel worse, even if the prostate hasn't changed. Managing stress is part of managing prostate health. Part 3 is about what you can do moving forward with confidence, not fear. First, understand that too big is a functional question, not just a measurement. If you're living comfortably, sleeping well, and emptying your bladder effectively, size alone may not require action. Second, simple habits can make a meaningful difference. Limiting fluids late in the evening, reducing caffeine and alcohol, and giving yourself time to fully empty your bladder can ease symptoms. These small steps often bring noticeable relief. I also encourage you to move your body regularly. Gentle physical activity supports circulation, hormone balance, and bladder function. You don't need extreme workouts. Consistency matters more than intensity. Here's another pattern interrupt for you. When was the last time you had an open, honest conversation about this topic? Many men suffer in silence because they're embarrassed. But prostate health is health, and there's no shame in taking care of yourself. Regular checkups matter, even when symptoms are mild. They help establish a baseline so changes can be recognized early. This isn't about rushing into treatment. It's about staying informed and proactive. If you've been worried that your prostate is too big, I want you to take a breath right now. Concern is a signal to pay attention, not a reason to panic. With the right information and guidance, most men manage prostate changes very successfully. Remember this takeaway. Your prostate doesn't define your strength, your masculinity, or your future. It's simply one part of your body responding to time and biology. When you respond with awareness and care, you stay in control. If this message resonated with you, take one small action today. Observe your symptoms, improve one daily habit, or start a conversation you've been avoiding. Progress often begins with a single informed step. And before you go, I want to hear from you. What's the one change you've noticed that made you start thinking about your prostate health? Leave it in the comments, because your voice matters, and this is a conversation no man should face alone.